Well, hey, y'all. So it's Dr. Kelly Clark over here at Patient PT on Bloomington, Indiana's North Side. And I am here with the third part in my series, The Top 5 Most Prescribed, talking about the exercises that I prescribe most frequently here at Patient PT. So in our first two videos, we were talking about foot and ankle exercises, okay? We talked about short foot, where you try to sort of deliberately arch your foot up higher, hold it for 3 seconds and then relax. And then we also talked in the second video about heel raises, kind of balancing on the ball of your foot, slowly raising your heel up off the ground, and then slowly lowering it back down. We talked about how that short foot really helps to strengthen all of the muscles that are inside your foot and provide a nice base of support. And we talked a little bit about how heel raises strengthen a lot of different muscles that run up through your ankles and towards your knee to help hold the ankle stable and not let it wobble back and forth like this. So that again contributes to a solid base of support for when you're walking, standing, running. So this is where it starts to get a little bit more complicated. I'll be honest, when it comes to sort of the middle section of the body, there isn't really a number one most prescribed exercise, but there is a number 1 and 2 most commonly involved muscles. And those muscles are the gluteus medius and the gluteus maximus, okay? So gluteus maximus, almost everybody's heard of gluteus maximus. It's this biggest muscle here that makes up your butt, okay? That is what gives a big round booty cheek for people who have a nice round butt. Up here towards the top is the lesser known brother to gluteus maximus called gluteus medius, okay? It's a smaller muscle. And if you were to look at gluteus medius by itself, I've got it illustrated here on my whiteboard up at the top in green, okay? So gluteus medius sort of starts a little around halfway across this iliac crest of your hip. And then the fibers run kind of obliquely over towards this bump on the outside of your hip, okay? So if you were to look at a spine model to try to understand where gluteus medius is, first of all, you turn it around because we are talking about the backside. And gluteus medius would be right about here and extend down to here on this kind of bumpy outside part of your leg. Now, if you imagine the direction of those fibers, you can probably pretty easily envision that it can help you to kind of lift your leg up and out like this, okay? These muscle fibers shorten here, it shortens the distance between here and here and brings this leg up, okay? So that's one thing the gluteus medius does, and that's something that we take advantage of in a lot of therapeutic exercises, including the Jane Fonda, the one that I decided to showcase today. However, the reason that gluteus medius has such a strong impact on pain and gets prescribed so frequently for exercise in physical therapy is because it has a much more important job when you're walking, standing, and running. So if you imagine that my hand here hanging onto the leg and crest of the hip is a nice strong gluteus medius, you can see it can hold this gluteus medius, this whole pelvis and spine up nice and easily, okay? It holds it nice and vertical. So even if this leg is swinging around in space like it does when we're walking, it can still hold the pelvis nice and stable, okay? So that's really the important part. You have a strong gluteus medius on both sides. It can hold your pelvis level while you are walking around. So you're not getting unnecessary torques, which means like unnecessary bendy, revolvy sorts of forces at the base of your spine. This sacroiliac joint here between the sacrum and the ilium is actually very stable. So a lot of times if there's rocking happening in the pelvis because gluteus medius isn't doing its job, that can translate to some level of rocking all the way up the spine. Okay, it also can lead to some level of rocking all the way down the leg. So a lot of times when we are looking at folks for a diagnosis in physical therapy of a specific muscle that is too long or too strong or too short or too weak, we start looking at stuff in the area of the pelvis, okay? If it is anywhere, if that pain that you're experiencing is kind of anywhere between here and here, okay? Because this entire like over 2/3 midsection of your body is sort of at mercy of what the pelvis is doing right in the center of it, okay? The knees can end up going together too much or coming out to the side too much if the pelvis is not strong and held nice and level during exercise. And when you're walking around and running and supporting the entire upper half of your body on that pelvis, it's subjected sometimes to really large forces. So what does all of this translate to for exercise purposes? Well, to be honest, that's a pretty complicated question. When folks have issues with one muscle, they almost always have issues with multiple other muscles because all these muscles work together in order to support you. So you can see this green peeking out from behind the hip, that's intended to illustrate gluteus medius and where it fits into some of these major muscles that support the pelvis. This blue guy here is the adductor group. That is the group of muscles that's in charge of bringing your leg in towards the midline of your body. And you can see the direction of these fibers, it's very well designed to do that. But I'm sure you might also be able to imagine that if this muscle was really tight, it would also have an effect on how this muscle, and this muscle all work, okay? So these other muscles, this is called psoas major, also known as iliopsoas, or just as a good old-fashioned hip flexor. So it's this purple one, okay? And you can see it comes all the way up along the anterior or the front part of your spine. So if you imagine lungs, internal organs, all that stuff kind of out of the way, that's where psoas lays. It's like the deepest muscle kind of against the wall of the inside of your body, okay? So it starts up here along the side of the spine. It scoops along the inside of your hip, also the very deepest part of your hip up against the bone. And then it comes out down here and goes underneath the inguinal ligament to attach to this inside part of your thigh, okay? So if we were to look at that on a three-dimensional model, that would be starting kind of up in this region, lining all along here, lining all along the inside of this, passing along here, and then coming to this bone on the inside, okay? So this bump on the inside of your femur, it's up really close to your groin. So a lot of times folks will come to talk to me about pain that they have in their groin or across the front of their hip. Sometimes folks will come and they'll have a pain that's actually kind of back in the backside of their hip, close to where that gluteus medius is. More often, a smaller muscle that runs from here to here, called piriformis, is compensating for weakness in gluteus medius and clamping down on a nerve called the sciatic nerve, which can cause shooting pains down your legs. Another thing that people will come to me with is knee pain because their knees are knocking in a little bit too close to one another, and that sets them up for kind of bad alignment here, and these things don't really move together ideally. So that's what I mean when I say that having weakness just in one little muscle here at the back of your hip, gluteus medius, can have an effect on anywhere in your body, from kind of the middle of your rib cage all the way down to the middle of your shin and even into your foot. A lot of times people will have pain when they are landing on their heel while they're walking. A lot of times that actually comes down to this hip drooping on every step because glute medius is weak, so their foot hits the ground a little bit harder. So these things can be very complex, but they're also not totally inexplicable. So what do we do about it? Well, one of the exercises that ends up working the best for people is one that I call the Jane Fonda, okay? So that's almost probably exactly what comes to mind if you have any mental image that you associate with the name Jane Fonda. Laying on your side and moving your legs around, okay? So I'm gonna pop up here onto my treatment table, illustrate it for you. So, lost my shoe, guess I'll kick the other one off too. So, you're going to do a Jane Fonda. Most people do these on a yoga mat, but of course I've got a treatment table here that's a little easier to film, so that's what I'm going to use. So to set yourself up, you lay down on your side, you line up your shoulder and your hip, which I usually do just by laying my arm along my side and making sure that my hip and my shoulder appear to be roughly in good alignment. A lot of times I'll actually put my hand up here on my hip so I can make sure that I'm watching whether it rocks forward or back, because you don't want either of those things to happen. Then you also will have your knees bent, okay? Usually about a 90-degree angle, but this is one of those things that varies a lot. Some people need to do this exercise with their hips kind of up here. Some need to put the legs kind of more behind themselves. We're all built a little bit differently. We all have different strengths and weaknesses in our musculoskeletal system. So those variations are natural. And that's why you need somebody like me to help you figure out exactly how to set yourself up best to do the targeted strengthening that you need so that you're not expending any more energy and exercise than necessary in order to get that pain back under control. Okay, so hips are aligned to shoulders, knees are bent, and we're holding our hand up here on our hip to make sure that we're not rocking forward or backwards. Then we straighten our top leg out, keep our toes pointed forward, and set our leg back slightly behind us. Usually when I do this, it feels the best for me when that leg is basically lined right up with the foot that is kind of bent back behind me. But use your own best judgment, because what really matters is that when you start to do this relatively simple leg lift, that you feel that motion and the energy and the work coming from this upper outer part of your hip, okay? Now, you may not feel anything at first, especially if you're going really fast, okay? You don't want to go fast. You want to go really slow. Try to make it just the smoothest arcing motion that you possibly can. Now, you can see I've been swinging my leg around kind of a lot. It's already starting to get a little bit more difficult for me to control. That's that slight shake that you see, especially kind of down in the lower part of the motion. That's my own special weakness. But if you do those in sets of 10, nice and slowly, you should feel them kind of here at this upper outer part of your glute. There are a lot of alternates to the Jane Fonda that still work gluteus medius, and some people need those instead. Sometimes I'll give people clamshells, which is more like this motion. Some people need to switch to a standing position in order to really feel these muscles working. And so that's why a lot of times in the initial evaluation, we end up trying 4, 5, even 6 different exercises before we find the one that really works well for a given person. However, I'll let you know a little secret. If I were doing a top 5 most prescribed to strengthen series where I was just talking exclusively about the muscles that seem to be sort of the most universally weak on folks, gluteus medius would be number 1, probably by quite a bit. Gluteus medius is sort of uniquely in a position to be overstretched and sat upon all the time because we all spend a lot of time sitting on our posteriors. So hip pain, low back pain, knee pain, even a lot of leg, ankle, and foot pain can all be traced back to a simple muscle called gluteus medius. You can strengthen it in a very targeted way by doing an exercise that a lot of people call sidelying hip abduction, but I call the Jane Fonda. And if that one doesn't work for you, or it doesn't feel good, or you feel like your back is doing most of the work, or you feel like something on the front of your hip is doing most of the work, there's probably something a little dysfunctional with your gluteus medius or even your gluteus maximus. And maybe you need to schedule a visit with someone like me to figure out who the weakest link on your particular musculoskeletal team is and get you back to feeling better. Because you know, a lot of folks think that growing older or gaining weight or having a child or any number of life changes that we all go through at some point have to result in you having pain that you just live with. And it's just not the case. The human musculoskeletal system is very resilient, and sometimes it's just a matter of finding exactly what you need to strengthen. So I hope this was helpful. If you need some more help figuring out your pain somewhere between here and here, give me a call over here at Patient PT, and I would be happy to get you in for an evaluation, see if we can figure out how best to help you live pain-free thanks to Patient PT. I hope you enjoyed.